everyone. Welcome to Real Talk Menthol Moments. I'm your host, Thelma Craig, and we're going to be talking about tobacco use in the black community, smoking. This talk is brought to you by the Colorado Black Health Collaborative. We've been working on this project, tackling menthol in the black community, for about 5 years now because we realize a very large percentage of black folk smoke menthol cigarettes. We are here to educate, to bring about awareness, and provide support to our community. Tobacco smoke is a major contributor of three leading illnesses among African Americans: heart disease, cancer, stroke. It's a health disparity. And we want you all to know that you're not alone in this struggle. This is also a social justice issue. Blacks have been targeted for decades by the tobacco industry, even without our awareness. Menthol money and manipulation. We are passionate about this work, and we want you to know that we will continue to offer culturally responsive resources to help our folks in smoking cessation or with smoking cessation. No judgment here. The struggle is real. So without further delay, let's have a real talk with our guests. We have two ladies who graciously agreed to join me to have an informal conversation about cigarette smoking and the challenges of quitting. Let me introduce you to Linda and Janet. So today it will just be two sister friends talking about smoking cessation. Hi, Linda. Hi, Janet.
Hi, Thelma. Thank you for
Good
having
morning,
me.
Thelma. It's
Oh,
good to be
good, good.
here.
Thank you both, ladies. I met you too because we all work in community um, navigation and community networking, and we really are all interested in the health of the community. And I really appreciate that. And I've seen you around doing the work, and so we're just really glad that you agreed to help in this discussion. Okay, so let's just get started. And I know that you had admitted that you are smoking, and you have challenges. You tried to quit. So I'm going to ask you first, Linda. How long have you smoked cigarettes?
I have been smoking for 54 years, unfortunately.
Wow, that's a long time. And but listen, no judgment here. Janet, how about you?
Probably about the same, off
Okay,
and
so
on.
that's really about a
You
hundred years
know,
between the
I
both
go.
of you. So, but that's okay because there people smoke and they stop and they smoke. But they do. There is an end point. We had a discussion on an event that we had recently, and we had a cardiologist on, a young black man here at the VA, Dr. Kamal Henderson, and he really had a great bedside manner in talking about smoking and how he helped the veterans in his facility to stop smoking and the challenges that they had. So let me just ask you, starting with you, Linda, how old were you when you first started smoking? And just where did you get the cigarettes from?
I was 14 years old, and unlike Janet, I was not over these past 54 years an on and off smoker. There has never been a day in my life since the age of 14 that I have not had a cigarette. And where I got them from, I'd steal them from my mom. She used to smoke Philip Morris cigarettes, and I'd
Mm.
steal them from her. My cousin would steal hers from her mom, or our classmates in school had stolen them from their folks, and
Wow, I
everybody had
heard that
cigarettes.
before. That the peers smoke, the parents smoked, and really that brings about, an interest for the children to start smoking. What about you, Janet? How old were you when you first started, and where did you get them from?
I think it was my last year of high school, and there was peer pressure. That was the cool
Yeah,
thing.
I've heard that a lot. Hmm.
We were, yeah, and then I had family members who smoked, so even without saying anything about it, that reinforced that it was okay.
Yeah, I
I
can
Hmm.
think,
understand that. I can
Hmm.
understand that because growing
yeah.
up, my grandmother smoked. My grandfather smoked. And my mother and father didn't
Hmm.
smoke, but my grandparents did. And I even had my grandfather. I think he rolled his cigarettes, and but it was fascinating to watch. And so I can see how children can be really impressed by that. And those are the kinds of things we want to change and we want to look at because, and like I remember I said, we've also been targeting the community. They used to pass out cigarettes in our community. really distribute the cigarettes, at events. And I'm sure y'all remember the Cool Jazz Festival and a lot of other things. Cool meaning the cool cigarettes, but play on words. Okay, so what brand of cigarettes, Linda, do you prefer, and how often do you smoke now? You said you smoke every day, but what brand do you use?
Coincidentally, when I first started smoking, I was still mommy's Philip Morris, and then when I got of age, so to speak, I
Hmm.
started smoking Cools, talking
Hmm.
about the Cool Jazz Festival. And in later years, I switched to Virginia Slims, yet they are
Yes,
menthol.
that's really those are menthol.
Hmm.
Cools were menthol too. I don't know. I think Philip Morris's. I don't know if they were
Hmm.
menthol, had menthol in them. Okay, they were okay.
They were, and Benson
Yes,
and Hedges in between, yeah. So it was Philip Morris, Cools, Benson and Hedges, and Virginia Slims,
yes.
all of
A
which were
large
menthols.
percentage of blacks, and studies have shown, large percentage of the black community use menthol cigarettes, and that's really is has to do with that social justice issue. What about you, Janet? What brand of cigarettes do you prefer, and how often do you smoke? Hmm.
Um, well, I smoke every day, but I've over
Hmm.
this last year, I had moved entirely off of menthol. So, but previously, much like Linda, you mentioned the Benson and Hedges draw. I forgot all about that. Yeah, that was that was some back in the days.
Hmm.
Yeah,
I made a
long and
line.
cool is kind of
That
what they
made it
call
look
sexy.
really cool. Yeah.
Remember the commercials and the ads in Ebony
Yeah.
and Jet
Right.
when they had this beautiful woman, holding a long cigarette, so that really was attractive, at
Yep.
that time. So but I know that, those are impressions on us, subliminal messages that came to us, like you said, as kids and in the media, that continues to happen. And we want to talk about that. So you're not alone in this. So let me ask you, Janet, did you have a strong cravings to smoke, or were you triggered to smoke based on things happening in your life now? And is that what continues to keep you smoking? Um, are you having strong cravings? Just what triggers you to smoke?
Yeah, I was doing pretty well. I mean, I have two sons, so whenever I was pregnant, I stopped. It was just like mental cut. It wasn't a struggle. I mean, it was just boom, you're
Hmm.
done with that. You got to bring a kid into the world, right? Uh,
Hmm.
and I pretty much, I would stay off for a while, especially with the first one where I was breastfeeding. I felt, I was very
Hmm.
aware of what I took into my body, so it wouldn't harm him. Um, so I've
Hmm.
had these periods where I come on and come off, blah, 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 blah. I'm pretty sure that, and maybe I'm taking a shortcut here in terms of being easy on myself, but I do think that I was doing pretty well of backing off, or at least cutting in half, and then the pandemic hit, and I could feel that isolation uh, kind of settling in on me, and then it was like, it's
Right.
sort of like I needed my friend. I needed my
That's,
friend
I've
back.
heard that a lot. It's a
Kept me company.
pacifier, or it's a
Yeah,
it really comforts you. And especially during
yes.
COVID when we were isolated and we couldn't really go out. So I can see how that can be something that will bring comfort. And really making it easy and doing something. I've heard a lot of people say that they actually like smoking. They enjoy the feeling that they get when they smoke. And what about you, Linda? Um,
You know, it's hard for me to say that I have had strong cravings for smoking when, as I've already said, there's never been a day in my life that I haven't. Um, I've developed some nasty habits regarding cigarettes. I mean, I pick up a cigarette before I change the gear shift in the car to reverse to come out of the
mhm,
garage, I've lit a cigarette. The minute I pick up a telephone, I've lit a cigarette. If I'm cooking in the kitchen, I got a cigarette burning on the kitchen table while I'm at the counter and just letting them blow up. I mean, watching TV, having a cocktail. all of those little things um, don't donate, don't translate to cravings for me, but rather habits, habits that I really need to work hard on breaking when I did make an effort to smoke. The last part of that question was were you triggered to smoke based on things, I think you said,
Yes.
happening in your life around you. I really worked hard in 2020, um, February and March, to put myself in a place mentally where I was ready to smoke. That was not easy for me. My dad stopped smoking many, many years ago, and my mom stopped smoking a good number of years ago. And when I told him, I'm really working hard, Daddy, to do this, he said, good for you, baby. And that was an inspiration to me. However, in March,
Mm-hmm.
just as the pandemic hit, I lost my stepson in Cleveland, Ohio, so I flew Denver to Cleveland to bury him. I came back 4 days later, and the nursing home that my parents were in, and I was doing very well, by the way. I was down to 4 cigarettes a day. I was using the patches and participating with the
The
um,
Colorado Quit Line, yes.
Quit Line program. I came back and I wasn't able to see my parents, which was
Mm-hmm.
that word you mentioned, stressful. I did visit with them via Duo. That was on March 9th through April 9th. And on the 13th, on the 9th of April, she and Daddy both got struck with the virus and they died 3 days apart. And I have been a pack and a half day smoker again ever since. I haven't
Well, I
made an
would
effort
certainly say
to
those are
stop.
triggers, because of the stress, and then having to cope with the death and probably being responsible for taking care of all the arrangements. And, I can see that needing that comfort
Yeah.
or that pacifier, so I can understand that. I'm sorry to hear about your parents, and especially in that short period of time. I had the same issue, you know, um,
Hmm.
several years ago, both my parents dying so close together. So that's a really hard thing. And so I commend you, though, for taking care of that. You're still here. And I commend you because I did hear, in a previous conversation we had that, you want to quit smoking. And so, but you're not alone. And there are a lot of things to do. And, to really start addressing that. So, well, thank you for sharing that, Linda.
You're welcome, and
Um,
thank you for your
so let me
condolences.
ask, the next question is, was there a time you realized, and I know you had said that, Linda, that there was the time that you realized that you should quit smoking. And you also said, Janet, that when you were pregnant, you stopped. But now, is there a time that's really, is this a time now that you're saying, I'm going to quit smoking? You know, is something happening now in this very time frame that really says, I should quit smoking? Is it a health issue? Are health issues plaguing you? And I know that's personal, but are health issues plaguing you? What is the strong forces having you say, I should quit smoking right now? Tell us about that.
I don't know that there's one particular thing. I think that I just realized, okay, I need to be, I don't like the idea of being so dependent on them. That's kind of really playing in my psyche lately. Um, so what I've done is, and I've just like Linda, I've gone through the quit line, done that, tattoos, Um, what I what I learned about myself last year when I was pulling back, I do about a half a pack a day. Um, so when I was trying to really kind of get a handle on it again, um, the good thing for me was that I now have a great outdoor city park near me, in my neighborhood. And so I got deeply into, like heavily into a mile and a half walking every day. And I do it on a speed level. So that was helping tremendously, in fact. I could tell the difference. I didn't cut out entirely, but at least I was able to cut back significantly, you know. So I'm back on thinking that through now, kind of getting ready for summer. So I started taking yoga again, which I did years ago. Um, and as I start building up, I'm going to build up and get there by the summer so that, boom, okay,
I
now
like
I'm in a
that.
headspace.
I
Let's
like
try
that
this.
because that was
Let's
kind of really my next question to both of you.
We'll
Like,
see.
what what are some of the methods used? I hear quit line, I hear the patches, walking, yoga. Those are all good things. And Colorado Black Health Collaborative, we're compiling um, culturally responsive resources. We're really trying to investigate and find that those networks and those resources that can help our
Right.
community stop smoking. We had a presentation, and I think I mentioned it to you. Um, Janet, about acupuncture. I don't know if you heard about the acupuncture, called acupressure, and they're using that method to help people. So there are more resources available too. And
Yes.
so and looking for those, we're here to share that information and and try it all. Do what you can, do what you got to do by any means necessary. So did you ever? Let me ask you. First, let me ask you, Linda. Did you ever talk to a doctor about how to quit? Physician, medical doctor?
Yes, I did. She mentions it to me every time I go, and I notice it on the explanation of benefits too. If she spent 1 second talking to me about not smoking, then she puts it on. She gets paid for that. Um, but yes, I have talked with her about it. We've talked about some of the prescription drugs that are available, and I don't want to go that route. I think what helped me,
Uh-huh.
here's my biggest issue, doctor or otherwise. The bottom line is Linda. That's the bottom line, is Linda. And I really have never visualized, I'm unable to visualize myself as a non-smoker. I had never been a non-smoker, so I don't know what that looks like.
Mhm.
I don't know what that feels like. I don't know that there's a difference physically, mentally, or emotionally between the two in terms of
Mhm.
behaviors and or attitudes. And that's why I was so proud to have worked so hard 2 years ago to get to a point where I was willing to do it. I am starting that mental gymnastics exercise all over again. That's where I'm starting at, is working on me and making an effort to position myself in a space where I can see Jeannie not being a smoker. I hope
That
that
does
answers
answer
your
my question
question.
because it is a challenge, and like you said, it's mental. And you're doing those mental exercises, Linda, to really make that happen. So we really, I think we both, Janet and I, understand where you're going with that. The mental exercises. Do you have any comments on the mental exercise and that, Janet, that you want to contribute to that conversation? That comment?
Well, it's much like what Linda was saying is picturing yourself and seeing yourself. Um, I've started putting post-it notes like at my desk or in my bathroom mirror, um, some affirmations like, you don't need this. You're good without this. You're fine. So like I said, I'm leading up to it. Uh, but I hear what Linda's saying is you got to be able to picture yourself not doing it, and
That's a very good
that's a big
comment.
part of it,
Picturing yourself.
of
You
realizing
know,
I don't
and I
need
can
this.
see that as part of the mental exercise. So I appreciate that. Have family or let me ask you, then, have family or friends ever tried to help you um, quit smoking? If so, what did they do?
No, not really. My dad's words that I mentioned a few moments ago when I said I'm going to make an effort to do this, Daddy, and he said, "Oh, that's wonderful, baby." That's the only thing
Hmm.
that comes to mind for me. My mom was one of 6 siblings, and they all smoked. Everybody smoked. As Linda mentioned, I mean, as Janet mentioned earlier, it was normal. It wasn't just cool. It
Right.
was just
Right.
a part of who you were. So I can't say that family has ever helped me
Hmm.
to
That's right.
quit smoking. The thought of my father is in my mind from 2 years ago when I did this, and I'm using that kind of as a a springboard to get the mental gymnastics
That's good.
oiled
I
and
like that.
working again.
Using it as a springboard, using it as equipment, to help you move through that gym of, mentally exercising. So I really like that, and I'm proud of your efforts. What about you, Janet? Have family or friends ever tried to help you quit smoking?
Yeah. And I know they mean well, but
Mm-hmm.
sometimes they come at me like too strong.
Hmm.
It just,
Mm-hmm.
yeah, and it gets a little too intense, and then I really
Yeah.
back up on them. Uh, and then you start doubling down, like, who are you to tell me? And then, oh, I'm the one with the habit, not you, yada, yada, um, so I may not say that to them, but they know it's like, okay, back up.
Hmm.
So it's not always, it, they have good intentions, I understand. They're saying that because they love
Well,
me. Got it. But I got to do this my way, or
I,
it's not
I,
going to
I
work.
agree. I
If
believe
I do
that,
it
and I can hear
somebody
in
else's
both of
way,
your
this is not going to work for me.
commentary,
I got to find
that
my
you
way.
really are trying, and you understand yourself. You know yourself. You see what's happening. And you really plan to work it out. So I really compliment you on that. Because you have that mindset that I'm going to quit. I'm going to beat this thing. So I like that attitude. And the family and friends, they love you, and they know, or they've seen other people, or had really challenges with this. So just keep the good attitudes about that,
Thank
and it'll come. I really just appreciate you both just sharing your ideas. Do you? Let me just go a little further with, like, and we only have a few more minutes. I don't want to take too much of your time. Do you um, see currently notice cigarette ads in the community? You still seeing the ads that you think that's contributing to us continuing to smoke in our community?
This is Linda. A couple of years ago, up until COVID hit, I was getting
Yeah.
coupons from Virginia Slims because I buy my cigarettes by the carton. And it would give me $3 off of a carton of cigarettes. Since COVID, they haven't been sending those coupons. And truth be told, I don't pay any attention to smoking advertisements because I'm already acclimated to the image. I'm familiar with that. It's not something that's unusual. One of my doctors has a
Hmm.
poster in her office that has
Hmm.
about 6 or 7 puppies in a row on this poster, and they each
Really?
have a cigarette in their mouth. And the caption reads, "Now I look like you." And I think about that. I keep that image when I'm going through these gymnastics things mentally. I
Oh
keep
my
that
God.
image in the
Wow.
back of my mind as well. That I don't see me as being different because I've smoked,
Hmm.
because I've done it for so long. But you being a non-smoker might look at me and say, "Ooh, yeah." And to me, it's just usual. So that image of those
Hmm.
puppies, I think there's 6 or 7 of them, just
Wow,
sticks in
that's
my
really
mind as
interesting. I
well
did
now.
a presentation a couple of days ago about images and communications in the community and how powerful that is. It's not what you say always, it's how you say it. And that image really is a powerful image. And so we're going to continue to focus on that. Thank you for that. What about you, Janet? Do you currently notice cigarette ads in our community? And if what so, where you see them, or how does that impact you, or not? Hmm.
I don't think it does. I really don't notice them that much anymore. I'm sure they're out there. You know, uh, I'm just in the zone of, okay, if I want whatever I want, if I want it, I'm going to go to the store and I'll buy it. Yeah. So I don't get coupons. I remember a couple of years ago I was receiving coupons, but that stopped. So it's not
Yeah.
like, I'm feeling that there's some kind of barrage of
Wow.
messaging out there for me. I just, I'm just not
One
too
of my
into that.
imaging, one of my
I really
images
want that my
is
money
the
in my
dollar
bank account.
sign of how much I'm paying for a carton of cigarettes. And I'm wanting to formulate images of
Well,
what I
yeah,
do with that money
that's
every
really
month.
kicking up.
Would I put it in a piggy bank and go to Vegas once a year with it or what? It's a lot of money that we're spending buying these cigarettes. When I'm doing twice as much as you, Janet, because I'm at a pack and a half a day. You're
You
only
are
at a half a pack.
absolutely right.
Not only, but
Wow,
you're at a
that's
half a
really
pack.
interesting. Looking at the money and the cost, and how
Yeah,
you're spending the money, because I
yeah,
can see using
yeah,
money is
like, yeah,
because I want to travel. Like you said, Vegas. I want to travel overseas. I want to do some European travel. So that's a really good point, and that's a really good incentive. To look at the money. Thank you for that, Linda. Um, so let me just ask. Do you think enough is being done to raise awareness in the black community? Because I know you both work in the community. Do you think enough is being done to raise awareness in the black community about the impact of menthol tobacco on our health?
Well, this is Linda. Your initiative is the first I've heard of efforts to raise consciousness about smoking in the black community. This is the very first time I've had an opportunity to participate in such an
Well, thank you
effort.
for that.
So I thank you for that.
I agree. And I think what would be really helpful
Mm-hmm.
if, both Linda and I started as teenagers.
Thank you for that.
So if you
We
could,
have
like,
been really trying to
nip it in the
engage
bud at that
youth
age,
and bring them on to our
you
coalition.
have
So that's
done
a really good
a
point.
major service.
So yes, I really appreciate that. So you know, there's a lot we could talk about that, and
Yeah.
I'm gonna my next real talk moments. I'm gonna try to have that doctor on that we identified, young black doctor who's working in this area and smoking cessation. Have him on because his manner was so soothing. In his presentation, I think that is a great opportunity to have someone on there to talk about that. We also have the Dr. Rhonda Coleman in May 23rd, talking about acupressure. And I'll send you the information on that so that you can listen to what she has to say. I think they're going to be doing more work around acupressure. Remember, they used that acupuncture in the 70s. When the Black Panthers start using that to help support the community around heroin addiction. So we're really trying to engage people. But I really appreciate what you both are saying about the mental exercise and really trying, and you're not alone. And I really, really, I am proud of you because you know yourself and you know the things that you can do. And so I'm just glad that you were able to come on here and share your life and share your challenges with me. I look forward to continuing to do work with you in the community because you have a voice. Everything you've said here today will help other people, to know that they're not alone. We're also looking at having a stop shop, to bring people together, and a lot more about that later. But bring people together so we can have these conversations more intensely. That brings me to, have you joined any type of support group or smoking cessation group to help you with this issue? Mhm.
Not,
Hmm.
this is Janet. No, I haven't. I mean, I think the closest I've come to that is with the Quit line for support. Um, I've often thought about, well, would it work for me to partner with a person,
Yeah, yeah, I can.
another smoker? I don't know if that would work.
I partner with you, Janet, but
Would
you're
you
too
guys
far
build
ahead
on
of
each
me
other
in
if
your
somebody
efforts
So
to
we can
stop. You're
learn. We
way
can
ahead
learn
of
from each
me.
other.
I'm,
Would you? Well, let's have an offside conversation about that. I'd be
I
happy to
That's
talk to you
great.
I'll
We'll
about
give
it.
we'll
you
carry
time
on
to
this
catch
conversation,
up,
and I'm going to reach out to you further so we can come up with some more
Absolutely, I
ideas
would.
on how we can really support each other and support the
Absolutely.
community in this issue.
But,
Because you ladies are vibrant, ladies. We want to have you around. So I really do care about your struggle and your compassion for this issue. So thank you for coming on. If anybody have any last parting words, you're welcome, Janet, to start. And have you have a parting word? Thank you. Thank you.
Mm.
I just want to thank you, Thelma,
I'm
and
gonna
CBHC. I
I'm
think
working on it, and
you're
I
right
want to
on
thank
target
you
with
all
this.
too
Just
for
keep
having
it
me
coming.
on. It's
Don't back
been
off, okay?
an enlightening conversation, and it has been the first opportunity ever for me to share my thoughts and my struggles with smoking with another smoker. So, Janet, I thank you for your willingness to share that with me. Mostly, if you interact with other smokers, which very few of my friends smoke now, you got a high five sign. I mean, you're not doing anything differently. So, to really hear your struggles and tie them to what I'm going through has been very helpful. And I think this conversation will be used by me as
Another tool.
another directional sign, another directional sign that maybe
Well,
I'm
I'm
headed
glad
in
to
the
hear
right
from you
direction.
both. I'm going to hold you to that. We're going to get together again, and we're going to talk about ways that we can support each other in the community with this, because I do think, like you said, Linda, talking about it, having the conversation, that's encouragement. So I'm going to let you go, and I really want to say thank you, and you ladies have a good day. I'll be in touch. Have a good day. Okay. Okay. Bye bye.